Joining us now is Republican Congresswoman Marsha Blackburn of Tennessee. She's also the Vice Chairwoman of the House Energy and Commerce Committee, which held yesterday's hearing. Good morning, Congresswoman.
Good morning, Carol. Thank you.
Thanks so much for joining me.
Sure.
CNN has looked into the medical privacy question and found the website does not violate HIPAA. In fact, the only health-related question is, do you smoke? So what specifically were you referring to on the website that could possibly violate HIPAA?
We are concerned about privacy overall, data security, privacy, and of course applying and complying with the HIPAA laws. And let's take Serco for an instant.
What question does it specifically ask that would concern you about HIPAA? What medical question does it ask?
Carol, HIPAA requires you to, it's the way you structure your website and the way you transit the information, the transfer rights that are there. And when you look at privacy on these websites, what you have to do is keep all of the application information in one server, and then you have, whether it is a physical server or a cloud server, and then you also have to make certain that you have the patient data information in another. You have to be certain that any of the information concerning disease or condition or pertinent to the individual is separate. All of our hospitals, all of our physicians, and our insurance
disease
companies
or health condition. The only health-related question asked is, do you smoke? HIPAA has to do with medical records, right? But you're not asked to provide any medical records or medical information.
It also has to do with the way you transit all of this information, and what we want to do is to make certain that each of these agencies, it is important enough that each of the contractors said they had been through some HIPAA training. What we wanted to do in the interest of privacy of our constituents is make certain as they build this data hub that will contain your medical as well as your financial information, and as this is shared with the different agencies, with the insurance companies that are going to be a part of healthcare.gov.
What medical information does the website ask for, and specifically what private information that the government doesn't already have does the website ask for?
What we want to make certain is the individual has a right to privacy. And as you heard in what was revealed yesterday in the privacy notice that is down in the coding, an individual is not given that right to privacy. So not only are we looking at HIPAA, we are looking at privacy. We are looking at how the companies handle this information. Serco said they had 2,000 individuals that are entering this information.
What kind of information are you talking about? What specifically does the website ask that I might be afraid might be shared with whomever? Like specifically, what information?
You should be very concerned, not only as you navigate the website, but as you make a purchase, and then as your information is handled. What we want to make certain is that an individual's medical information, their financial information, is all going to be kept in a private manner. What people do not want is a peeping Tom that is going to look through their private or any of their PII, their personally identifying information. They want to make certain that the federal government has standards and are applying and abiding by the privacy laws that are on the books and by the HIPAA regulations that every hospital and every doctor abide by. So this is a serious investigation looking at the entire rollout and launch of this website, how this data is being used. You know, Carol, it was so interesting yesterday.
I understand your concern about hacking into the site, because that is a real concern, because it's not working right now.
And the identifying information is of concern.
Specific information, I'm just not clear on what the website asks you that would violate HIPAA.
As individuals navigate the website, as they work through finding a product, as they make a purchase, as they have their information that is going to as it's going to be data mined, if you will. What you have to make certain is that information is separated from patients and individuals, and that it is going to be anonymized, and that individuals have an expectation and a right of privacy that the federal government is going to abide by that. Now, when you have a company that is utilizing as many as 80 or 100 different servers, whether they're physical or they're cloud servers, you have to make certain that the encryption is there, that individuals who are setting up accounts have set passwords, that those passwords are being changed within every 90 days. All of this is HIPAA healthcare compliance, and it is the customer's expectation of that privacy. If these individuals are not engineering those websites with these protections, with these encryptions, if they are not making certain that people do not have physical access to those websites and the information held in them, then they're not going to be compliant with federal law. And we want to make certain that they are going to be compliant.
I understand. Again, the only health-related question this website asks is, do you smoke? But I hear what you're saying.
I think there are other questions that are there. There are other questions that are there, and so we're going to continue.
Congresswoman Blackburn, thank you. Thank you so much for joining me this morning.